Miss B, you're back already? You were just here last week. What happened?
I started feeling short of breath and I couldn't get into my primary care physician for another month. I couldn't go on like this the way I was breathing.
Well, that's understandable.
Honey, I hate to eavesdrop, but did you just say you were admitted again after being discharged for heart failure last week?
You heard correct. I just can't stay out of this place. At least the nurses are nice.
I was in the same boat a few months ago. I was basically part of the staff. I was here so much. I'm here today because I broke my foot and I requested this floor. I started going to the heart failure clinic about a year ago and I haven't been readmitted for heart failure since.
This place sounds like a dandy. Nurse, can you tell me more about it?
I sure can.
Heart failure clinics can help reduce the cost of heart failure-related readmission rates. 5.3 Americans are suffering from heart failure, in which 1 million are admitted into the hospital each year. In 2008, the estimated cost of heart failure was $34.8 billion. As of today, the readmission rate for heart failure patients is too high, ranging from 29% to 47%, while 50% could have been preventable. Recently, heart failure clinics have been established worldwide, including the United States, Canada, and European countries.
Research has found that follow-up care at an outpatient heart failure clinic is cost-effective, does decrease hospital readmission, increases patient compliance, increases quality of life, and decreases mortality.
Tell me about some of the research you found about heart failure clinics.
Well, there's one descriptive study in which concluded that heart failure patients who received follow-up care at a heart failure clinic resulted in fewer readmission rates and improved symptoms compared to follow-up care with their primary care physician. The study is 10 years old, but it does foreshadow the effectiveness of heart failure clinics nowadays. A randomized controlled trial in which one group received follow-up care at a heart failure clinic while the other group received follow-up care with their primary care physician. The intervention group did result in decreased hospital readmissions, decreased mortality, decreased stays in the hospital, and increased self-care scores.
Looks like heart failure clinics have really made quite an improvement with readmission rates.
Yes, it has. For example, another study focused on the research topic of a heart failure clinic reducing readmission rates. The heart failure clinic group had 4 patients who had a total of 5 readmissions within 1 year. The non-heart failure group had 85 patients who had a total of 187 readmissions within 1 year. 39 of those patients crossed over to the heart failure clinic group and had a 60% reduction of readmission rates.
That is quite a reduction in readmission. How costly is heart failure clinics?
It's actually quite cost-effective. There is a cost-effective study that comes to mind. It went over a period of 12 years. The total cost of the follow-up care group was $66,532, while the standardized care group was $53,638. The cost at a heart failure clinic was $52 per 30 patient days. The life expectancy of the heart failure clinic patients was 3.9 years, while standardized care patients was 3.21 years. Therefore, the cost is worth the outcome, which is added years to one's life.
Well, thank you so much for your time. I'm now convinced that heart failure clinics are going to be a great way to help patients live longer and a more fulfilled life.
You're very welcome.
Heart failure clinics provide education for disease management, including easy-to-read materials, daily weight logs, recognition of early problems, medication management, telephone consultations, in coordination with the patient's primary care physician or cardiologist.
Other services include evaluation for biventricular pacing, or CRTD, implantable cardioverter defibrillator, or ICD, left ventricular assistive device, or LVAD, and IV diuretic therapy such as Lasix.
I've been following up the heart failure clinic for over 3 months now, and I've never felt better. I feel like I'm doing everything humanly possible to take care of my heart condition by going over there and taking their advice, staying within the salt and water intake limits, and taking my medication as prescribed to me in the appropriate manner and timely fashion. You can tell my story because you know that I'm an example that it worked.
Now that you know the services offered at a heart failure clinic, seen heart failure patients who have had great outcomes, and learned about research that supports heart failure clinics, they are leading to decreased hospital readmission rates, increased quality of life, decreased mortality, and increased patient compliance, while at the same time decreasing hospital costs related to fewer readmissions.